Hey everyone, I'm going to do just a quick overview here of some of the different kinds of psychological treatment or therapy that your book talks about. Um, I'm not going to be able to go in depth on these things as much as I probably would like, since this is basically what I do for my job. But um, I can at least give you kind of an idea of these different treatment approaches that you might get if you went to go get therapy from somebody. The first one your book talks about is psychodynamic therapy, or it's called um, sometimes psychoanalysis. And this is a Sigmund Freud thing. You may remember us talking about psychodynamic theory, Freud. And if you do remember that, you might remember that Freud is interested in our unconscious, right? Okay, so if you went to get therapy or psychoanalysis from Freud, he would have you lay down on a couch, he would sit behind your head so you can't see him, and then he would ask you to do what's called free association, which is where you would just talk about whatever thoughts or images or memories popped into your head. You would say them out loud, and Freud's hope would be that by just kind of saying whatever comes into your mind, something from your unconscious may kind of percolate to the top of your mind. He also liked to analyze dreams. He analyzed what was called transference, which was the relationship between himself and the patient. Um, and the purpose of this would be to kind of recognize unconscious thoughts and emotions and figure out how those are impacting your current life. And he liked to see people a lot. It says here 3 to 5 times a week for several years. You don't see a lot of people doing that anymore because, for the most part, insurance companies won't pay for it. Um, I'm not a huge believer in this stuff, but one kind of variation of this that I do like is play therapy. This is where if you've got a young child you're trying to do treatment with that can't talk to you about their emotions, you can sometimes have kind of games or art activities that will allow them to express some emotion, some unconscious feelings without verbalizing it. So that's kind of a contemporary variation that I like. The second kind of treatment that your book talks about is humanistic therapy. Very famous um, psychologist here named Carl Rogers, and he called his humanistic therapy client-centered therapy or person-centered. Here, Carl Rogers would be sitting with you talking, and he would show you what he called unconditional positive regard, which is where he values you as a person, uh, no matter what. He uh, he will tell you about how valuable you are and how encourage you towards growth. Rogers would also be interested in empathy. He would be trying to figure out what your experience of life is like. And a humanistic therapist would say, you know, I'm not the expert. You're the expert on you. You have all the answers, and my only job is to maybe kind of help you get out of your own way a little bit. But if you're looking to me to find the answer to all your problems, I'm not going to be able to give that to you. Okay, so I really like aspects of this kind of therapy. I do some of these things. And then the final kind of therapy your book talks about is behavior therapy, or these days, what you see more is cognitive behavior therapy, CBT. Here, what we're saying is psychological problems are learned over time. Thinking patterns are learned, um, behaviors are learned, and so if they're learned, then we can learn to do things differently um, if we want to. And so here, traditional behavior therapy is going to be involving things that are much more behavior oriented, as you might imagine. So rather than just talking about problems, you're actually going to be doing things. So with systematic desensitization, this would be where, let's say you had a fear of heights and you're coming to me for therapy. Rather than just talking about it, what we would do is week after week after week, we would do things that involve you getting higher off the ground. So we might start with a step stool, we'd make you stand on it, and then we would talk about your anxiety. And the next week we would go up a ladder, and then the next week we're on top of the building. I mean, not really, but it's a behavior treatment. And I'm not going to go through all these, but you'll want to read about these in your book. I think there's some test questions about them. Um, Reinforcement is a big part of behavior therapy. So here's a slide where, and if you can't see this on here because the type is so small, I think it's in your book. Here's where you have a child with autism, and since children with autism have trouble with social cues, here we're trying to get our child to say please, thank you, and you're welcome more frequently. And so there's a baseline period where we just see how often is this kid doing this. And you can see it's not happening very much. But then we're going to start our treatment, and we're going to start reinforcing the child every time they do this behavior with something that the child likes. Maybe it's Skittles or whatever. And you can see once we start doing that, the frequency of the behavior goes way up. So that's a classic example of a behavior therapy. What I spend a lot of time doing with people in my private practice is cognitive behavior therapy. Um, and the concept here is that some of the same things from behavior therapy. Our behavior is a learned thing, but what I really focus on is the relationship between thoughts, behavior, and emotion. And it's kind of this triangle, and all those things influence each other. And if that's the case, then when I see someone like who is depressed, one of the things we will talk about is how there's a connection between the thoughts we have and our emotional state. And with people who are depressed, you find that they're having a lot of very negative, depressing thoughts. Things like, I'm no good, this is never going to get better for me, um, other people don't have to suffer the way I do. And then we can see if you're having thoughts like that, your emotional state is going to be sad, hopeless. And then if you're feeling sad and hopeless, we go and look at your behavior. What do we see? Well, you just lay around all the time. Maybe you're eating or drinking too much. You don't enjoy things anymore. And so then we kind of learn that, and then we work to start changing at least one or two of those points on the triangle. So we'll start examining our thoughts and determining if they're actually true or not. What you often find with people who have depression and anxiety is their thoughts are very distorted. And then if we can kind of correct those, then their emotions tend to get a little bit better. And I'll also encourage people who are depressed to change their behavior. One of the first things I tell them to do is start getting exercise, because depressed people don't feel like doing too much. They don't have a lot of energy. And so if I can get them moving, get them exercising, they often find that their mood starts to get better as well. Okay, so I think that's about all I'm going to go into with respect to treatment. But if you guys have any questions, you can email me. Otherwise, take care.